Hello and welcome to my presentation on GDPR and eHealth systems for behavior change. I'm Eunice Agyei, a doctoral student at the University of Oulu and the co-author of the paper titled GDPR and eHealth systems for behavior change, a systematic review. The introduction of technology to the healthcare domain has yielded a number of benefits, including the reduction of cost, enhancement of the quality of healthcare, an increase in accessibility, and an overall improvement in the quality of life. The CHRes roadmap serves as a guideline for the development, implementation, and evaluation of eHealth systems through a 5-stage iterative process. The roadmap consists of contextual inquiry, value specification, design, operationalization, and evaluation phases. Contextual inquiry, which is the first phase, focuses on gaining an in-depth understanding of the current state of the problem at hand. By so doing, identifies and analyzes the roles and needs of various stakeholders who fall within the scope and context of the problem. Next comes the value specification phase, which involves the identification and elicitation of specific benefits of the technology based on stakeholder needs. These values are then translated into end-user requirements. In the design phase, user requirements of the system are identified, followed by the development of mock-ups, prototypes, usability tests, technology development, and the addition of usability principles and persuasive features to the design. Operationalization, which sits forth in this iterative process, outlines plans for the operationalization of the technology. Concrete activities such as pilot programs, advocacies, and presentations are used to increase the awareness of the technology. Last is the evaluation phase, where formative or summative assessment of the impact of the technology on the problem context as well as the stakeholders is done. This ensures that the value added to the stakeholders' life is apparent. The CHRes roadmap aids in the planning and execution of the development process of eHealth technologies and can be a valuable tool for the improvement of existing technologies. What if you can have control over your own data? GDPR is a data protection regulation which emphasizes on the need to protect the citizens of the European Union from privacy and data breaches and the consequences of non-compliance. It is famous for the penalties associated with non-compliance and protects the rights of data subjects, which includes right to be forgotten, right to access, and data portability, which was not the case in previous legislations. In event of a data breach or non-compliance, an organization may incur a fine to the tune of 4% of its annual global turnover or 20 million euros, whichever is greater. GDPR requires the data of people living within the European Union to be processed within the EU, regardless of the location of the company. This means that any business entity that seeks to process the data of EU citizens must have a representative in the EU. Consent is another GDPR requirement, which demands that user consent be written in clear and plain languages and that it is informative, accessible, and easy to withdraw from. It also specifies requirements for proper record keeping of internal data operations. GDPR has principles and rights for data subjects, and its implementation in eHealth systems brings new design requirements and responsibilities and expenditures, leading to significant impact on eHealth organizations. A systematic literature review was conducted using 5 academic databases, where we identified and retrieved 213 articles Of these, we removed duplicates, leaving 168 articles, which were then screened. After screening, 140 articles were discarded and the remaining 28 articles downloaded. A further 5 irrelevant articles were identified and excluded, leaving 23 articles for analysis. We analyzed the 23 articles using the CeHRes framework, where we grouped the articles according to the phases identified in them. Out of 23 articles, 22 had the contextual inquiry and value specification phases. The design phase was present in 16 out of 23 articles. Operationalization and evaluation were present in 4 out of 23 articles. The contributions of this paper includes an analysis of the influence GDPR has on privacy requirements for eHealth systems, the identification of challenges GDPR poses to the development of eHealth systems, as well as key privacy requirements for the design and development of persuasive eHealth systems. In the contextual inquiry phase, the problem we identified in the study centered around data privacy, consent, data ownership, security, right to be forgotten, cyber insurance to cover eHealth assets, among others. One study identified and analyzed the stakeholders. They used surveys to collect privacy concerns of stakeholders, which were then translated into user requirements. In the value specification phase, privacy-related values were identified and translated into requirements. Examples of the values include respecting user privacy, protecting user data, and providing an informed consent. In the design phase, the outputs of both the contextual inquiry and value specification phases were translated into unified modeling language diagrams, conceptual designs, system architectures, and low to high fidelity prototypes. In addition, persuasive features such as self-monitoring, personalization, and reduction were identified. This was followed by the development of eHealth systems that address some of the privacy challenges of eHealth systems. Potential solutions for the identified privacy challenges in the contextual inquiry phase includes privacy by design for managing eHealth records, system for managing user consents, the use of visuals to display GDPR requirements, blockchain-based solutions for managing ownership, trust, and data portability. Privacy extraction and prediction system, software architectures for storing and transmitting data, as well as a framework for risk assessment and insurance against risks. In the operationalization phase, some studies implemented and tested out their solution through proof of concepts, field studies, integration of the developed technology into an already existing system, and pilot studies conducted in real-world environments. In the evaluation phase, the values specified were assessed as well as their impact on stakeholders. eHealth systems that support behavior change are developed with persuasive features to enable and support users change their behavior over time. From our analysis, we identified some persuasive features in eHealth systems. These include self-monitoring, personalization, competition, reduction, reminder, system credibility, and gamification. Persuasion through self-monitoring and personalization is carried out based on the data of the information system. It is important that this data meets GDPR requirements of the consent to collect store and process data, the right to access data, the right to be forgotten, as well as privacy. As such, these privacy requirements must be properly incorporated into the design of behavior change systems. The Persuasive System Design Model was developed to aid the design and evaluation of persuasive systems. It involves software features that support the user to perform the primary task of the eHealth system, supports the human-computer interaction, supports the credibility of the system, and provides social support if necessary. Persuasion occurs via the content of eHealth system, software features offered, the credibility of the system to function, and privacy trust. For example, the content and software features may have conflicting implications on the privacy of the user. Persuasive systems rely on user data such as goals, preferences, lifestyle, as well as objective data such as phone app usage, heart rate, which are obtained from mobile and wearable device sensors. The availability of such data enables persuasive systems to create and make better recommendations to users, for example, to match the content to user preferences. Such user data is subject to GDPR requirements. Hence, in building persuasive systems, it is important to consider how the various data subject rights can affect the performance of the system. For example, in the case of the right to be forgotten, unresolved privacy issues and concerns may act as barriers that influences the adoption and use of eHealth systems. We generated examples of GDPR requirements and their implementation based on the PSD model and further grouped based on the kind of support software feature offers. For example, for eHealth systems that offer self-monitoring, an example GDPR requirement can be that the system limits data collection to what is necessary for persuasion to be effective. An example implementation will be that the app limits the amount of data to what is needed for self-monitoring functionality. Our research agrees with other studies that have shown that privacy remains a concern for electronic health records produced from eHealth systems. For such systems, data about the user is collected. A user may enter their own data, or data may be collected using sensors embedded in mobile and wearable devices. Persuasive features that are generic and unique are all data sensitive. For example, persuasive strategies such as monitoring, tracking, and personalization may affect the privacy of users. Not only is the data sensitive, but may also trigger what is popularly known as the placebo effect, as well as undesired outcomes, which may lead to coercion and falsification of information. These issues have the tendency to affect the efficiency of an eHealth application, particularly for systems that offer personalization and recommendations. As such, the designers and developers of persuasive technologies should aim to protect the privacy of users as their own. GDPR presents a tall list of requirements for persuasive systems, which may be difficult and overwhelming, but let's look at it this way. First, identify the privacy challenges from the context. Specify the values that are associated with the privacy challenges. Identify the corresponding GDPR requirements and translate them to software requirements. Incorporate the specified requirement when developing the app, and then plan to launch the system. In addition, assess the system based on the values as well as the impact the technology has on its stakeholders. To conclude, A holistic approach for the development of eHealth systems is essential. Behavior change support systems must fulfill GDPR requirements. Privacy and data subjects' rights must be anchored in eHealth systems. There is a need for more studies on how data subject rights should be implemented in eHealth systems. There is a need for research and practitioners to work together to ensure compliance of eHealth systems to GDPR requirements. And finally, a human-centric viewpoint should be given more focus in the development of eHealth systems. Thank you for your attention.